Well, Amazon's Alexa can do a lot of things, like, for example, tell you the weather, play your favorite podcast, even order you paper towels. Now, Alexa can even offer medical advice with the help of HealthTap's Dr. AI. Watch this.
So what symptoms do we need to know about? You can say things like fever, rash, headache, and so on.
Dizziness?
Any other symptoms? Say yes or no.
Yes.
Okay, tell me the other symptom.
Nausea?
Okay, you said nausea. How would you describe Victoria's nausea right now? Let's go over our findings. Okay, 10,636 doctors helped me compute these findings. Wow, that's a lot of white coats. We found 5 possible explanations. First is vertigo, which is somewhat likely.
Wow. Joining us right now is the founder and CEO of HealthTap. He is Ron Gutman. And Ron, it is good to see you. Thanks so much for joining us.
Thank you for having me,
Well,
Maria.
this is incredible that you could be at home asking Alexa, and she's going through thousands of doctors to come up with an answer. How does it work exactly? Walk us through it.
Absolutely. So it's very, very simple. So, voice-activated interfaces just allow us to access this amazing knowledge base that we built over the past almost 7 years right now with more than 107,000 physicians that answers people's questions online. Basically getting any question about health and well-being and creating this amazing library, but also a training set that now we're using artificial intelligence to find the patterns, and given a set of symptoms and context of your personal health record, can compute likelihood of particular conditions and send you to the right level of care.
And she's going through 6,000 doctor diagnoses just from a couple of words like dizziness, nausea, whatever it is.
It's a lot more than 6,000. It's actually going through billions of data points. Anytime that you actually provide a set of symptoms and a context, it will take the relevant data point. In this case, it can be thousands, it can be tens of thousands of doctors' opinions that came over the years, and not only answering questions, but also peer reviewing each other's answers for quality, right? So doctors are reviewing each other's answers, creating this statistical model that enable us to take a training set, train the system, and give you insights.
So Ron, Palo Alto is the heart of apps. What brought you to Alexa versus doing your own app and not sharing the insight, with Amazon?
That's a great question.
Well, so we created our own app. So HealthTap has its own apps on iPhone, Android, iPad, Android tablet, web, wearables as well. We love the whole notion of voice-activated interfaces. We started working on it about 3 years ago. We launched an app called Talk to Docs from HealthTap Labs and started iterating on voice-activated interfaces. When Alexa came in, which is great, it's a platform, it enables us to take the technology that we've built over the years and put it in a platform that is very accessible to people. Now, in healthcare, it's really important because beyond being cool, I mean, voice-activated interfaces are cool, it's actually very useful. Think about it. Elderly people, people with conditions, right, frail people, it's hard for them to manipulate digital interfaces with their hands. Their eyesight many times is not as good. So voice-activated interfaces gives us the only opportunity to actually give them advice, provide them access to digital interfaces.
So Alexa is global. Is your interpretation and your doctor recommendation, is it a global response or just a U.S.-based response?
No, absolutely. We have more than 107,000 physicians in the U.S. today, but we provide the information to people in more than 100 countries around the world. So we actually are open to many other people. So we also have HealthTap in Chinese that is available to people that speak Chinese, but also people are using us in many, many countries around the world in English.
But we got to talk about the privacy concerns, because this is obviously the big issue within healthcare. The app logs personal medical information like what kind of medications a person is taking. How do they know that that data is safe? They don't want that data getting in the wrong hands.
Of course. So HealthTap has the Health Operating System, and the Health Operating System is HIPAA compliant. It's actually SOC 2 Type 2 certified, which is the highest level of privacy and security in the world. We're actually externally audited for privacy, so we're taking privacy really, really seriously, security even more so, because we think that healthcare needs to be the utmost secure thing that exists, right? So we're working with doctors, but we're also working with the best engineers in the world in Silicon Valley that make sure that your data is safe and secure at all times.
How often is a misdiagnosis occurring?
Right, so we're not diagnosing. The fact that we have 107,000 doctors in the network and available a click away means that we are providing information to people and guidance to the right care at the right time, at the right cost, but the doctor is a click away. So if you actually are using Dr. AI for Alexa, you actually get some set of potential pathways to
Yeah.
getting to a doctor, but you can push a button and get in front of a doctor in seconds.
So you have no liability. No liability.
So we have a responsibility to make sure that what we're providing to people is the right information to get the right care at the right time,
Yeah.
and connect them to the right doctor that will give them advice
Yeah.
and will give them prescriptions and provide care.
Do you get feedback on the accuracy to continually improve that?
Absolutely. We're working with the physicians all the time to continue improving the systems. The physicians continuously are engaged in QAing the system and helping us provide better answers to people and better care at the right time.
Really fascinating stuff. Ron, we'll be watching. Really interesting.
Thank you.
Thanks so much for joining us. Ron Gutman there. Health Tap is the company. We'll